Hospitals around the U.S. are treating an influx of people with COVID-19 and related symptoms, but that doesn't mean that they're not treating emergencies. Touro Family Medicine Physician Dr. Meredith Maxwell joins us to explain when patients need to go to the hospital or to the doctor. Good morning, Dr. Maxwell.
Good morning.
All right, so you're telling me that there are actually stroke patients, and we've read about that, stroke or heart attack patients that have been reluctant to go to the emergency room because they don't want to catch COVID?
Correct. I think patients are so afraid of what could happen that they are avoiding medical care that's necessary and actually preventable. If you get to the ER fast enough, you can, reverse things. So I'm seeing patients that are having symptoms that just won't go to the ER.
I think let's go off topic for just a second and take a little tangent. Everything I've ever read suggests that with stroke especially, and even heart attack, those first moments that are critical to the ultimate recovery.
Correct. I had a patient that I was talking to, I was like, it's the risk of not going is greater. And, he waited, and unfortunately, that it was not able to be reversed. So I think the key is, if you're not sure about whether or not to go to urgent care or see your doctor, because we are seeing patients, or a telemedicine visit versus the ER, reach out to your primary care. We can help guide you.
All right. So
if we think it's an emergency, we'll send you.
So from how the patient is feeling or how your loved one is feeling, when should you go to the ER?
Any sudden change from baseline, sudden weakness, sudden chest pain, sudden abdominal pain, problems swallowing, sudden vision changes, women feel heart attacks different. So any change from your baseline, you need to be aware of and contact your physician. So know yourself. And I think I talk about that all the time, is know what's normal for you.
911 is kind of the next level. At what point are you aware that, okay, this is not just, go to the emergency room on our own. This is life-threatening?
The shortness of breaths, the severe pain that you can't even talk or breathe. Of course, if you have sudden loss of consciousness. And I want to reassure people that these ERs are separating COVID patients completely different areas with different rooms than the non-COVID. So don't fear going to the ER. Doctors are taking precautions to protect you. Well,
I know you're doing a lot of telemedicine, I believe you told me in the morning, and then even when patients are being seen, I had a medical appointment, the first one the other day, and it was a very different experience of waiting in the car. What is Touro doing?
So we are triple screening. We are taking temperatures with infrared thermometers. We are giving masks to every single one of our patients. Everyone in the clinic has a mask. All the offices have been deep cleaned, terminally cleaned for your protection. We are taking in charge of the social distancing, so you don't even have to think. There's not a chair available at that space. We're trying to room patients earlier so you don't even see anybody in the office. So trust me, we are taking your best protection at heart. We are doing everything we can to protect our patients. You do need medical care. That did not stop because of this virus, so we want to help you.
No, life goes on. All right, Dr. Meredith Maxwell, thanks. As always, we appreciate that.